What happens when somebody has a glass, we always hear a glass or two of wine in the evening? How does that impact their sleep? And then we'll be sure to circle back in terms of what is reasonable ranges of behavior when it comes to avoiding alcohol, or if it's age appropriate, et cetera, enjoying alcohol.
Yeah. So alcohol, if we're thinking about classes of drugs, they're in a class of drugs that we call the sedatives. And I think one of the first problems that people often mistake, alcohol is often used as a sleep aid for people who are struggling with sleep when things like over-the-counter remedies, etc., or herbal remedies have just not worked out for them. And alcohol, unfortunately, is anything but a sleep aid. The first reason that most people use it is to try and help them fall asleep. You know, if we look at the pattern of brain activity, if I were to place you inside an MRI scanner where we're looking at the activity of your brain and watch you drifting off, some parts of your brain will become less active, other parts will become more active. And this is the push-pull model. It's inhibition, excitation. But alcohol is quite different in that regard. Alcohol is, because it's a sedative, what it's really doing is trying to essentially knock out your cortex. It's sedating your cortex. And sedation is not sleep. But when we have a couple of drinks in the evening, when we have a couple of nightcaps, we mistake sedation for sleep, saying, well, I always, when I have a couple of whiskeys or a couple of cocktails, it always helps me fall asleep faster. In truth, what's happening is that you're losing consciousness quicker, but you're not necessarily falling naturalistically asleep any quicker. So that's one of the first sort of things just to keep in mind. The second thing with alcohol is that it fragments your sleep. And we spoke about the quality of your sleep being just as important as the quantity. And alcohol, through a variety of mechanisms, some of which are activation of that autonomic nervous system, that fight or flight branch of the nervous system, alcohol will actually have you waking up many more times throughout the night, so your sleep is far less continuous. Now, some of those awakenings will be of conscious recollection the next day. You'll just remember waking up. Many of them won't be. And so, but yet your sleep will be littered with these sort of punctured awakenings throughout the night. And again, when you wake up the next morning, you don't feel restored by your sleep. You know, fragmented sleep or non-continuous sleep in this alcohol-induced way is usually not good quality sleep that you feel great on the next day. The third part of alcohol in terms of an equation is that it's quite potent at blocking your REM sleep, your rapid eye movement sleep. And REM sleep is critical for a variety of